Hey, so I had a great meeting with, or podcast with my dentist, Dr. Vigorin, yesterday. We had a lot of really good things to talk about. And of course, after we turned off the cameras and the microphone, we continued to talk, and we should have been recording that as well. So there's a couple things that I wanted to share with you. And it really has more to do with the thought process of holistic thinking. And I've touched upon this, and this is in a playlist about holistic thinking, because I think it's important for you to understand how a holistic doctor thinks. And since I'm a holistic doctor, how I think about you as an individual, and I think about you as an entire person. So, first of all, you've got to get the fundamentals. You've got to get the pillars right. And those pillars oftentimes aren't really talked about, but we go in depth when we work together with those pillars. So what does that look like? It means diving into your nutrition. And one of the things that I don't really like to get into too much are all of these different fad diets or different types of diets, because the diet that works for you is really the only diet that matters. And your nutritional requirements might change depending on what season you're in. So in your 20s and 30s, your nutritional requirements might look different than in your 40s and 50s, which might look different than in your 70s and 80s. You might have been unlucky and had some kind of exposure environmentally or some illness. That might change your nutritional requirements. If you have some kind of gastrointestinal illness, that might dramatically change how you absorb your nutrients, and then there needs to be a different strategy that's applied. Your sleep is also very important. Some people have interrupted sleep. So if that's the case, then we need to make sure that you're getting enough sleep cycles. These sleep cycles, for most people, are 90-minute chunks of sleep. And so let's say you're sleeping 4.5 hours each night. Well, maybe you can get 1 or 2 sleep cycles in during the day. So now you're looking at, within a 24-hour period of time, you're sleeping 7.5 hours. And that might be sufficient for you and allow the recovery that's needed. It's also important that you exercise appropriately. It's also important that you're drinking enough water. And then something else that's really important is you have to feel valued. You have to feel a part of your community. And I think that's something that doesn't get talked about. Oftentimes people find that through their work, perhaps through their church or through volunteering, through family. But when something, or oftentimes through sports and through teams, through activities. So if you're an athlete and you have an injury and now you can't participate with the team, that can be devastating. If you have retired and you didn't really plan ahead, or you didn't have activities or things that you were doing outside of work, that could be very challenging. I've seen people, and I know that you've probably seen this as well. I've seen people retire, be happy about retire, and within a year, they're sick, and within 2 years, they're dead. And a lot of that has to do with that sense of belonging, a sense of purpose. So these are the fundamentals, these are the pillars. These need to be looked at in order to look at you as a holistic person in your entire well-being. Now let's get into some of the differences between conventional medicine and holistic medicine. There's lots of different types of holistic medicine, and it's practiced in many different ways. But where the rubber meets the road is oftentimes in holistic medicine, it's not just the symptoms that are being treated. So conventional medicine is really focused on symptom management and either suppressing or overriding symptoms so that you don't experience those anymore. The problem is what hasn't been addressed are the causes of those symptoms and the mechanisms behind those symptoms. So when you see a holistic doctor, whether or not it's said, oftentimes what's happening is there's three things being addressed all at the same time. The symptoms are being addressed, the causes or the insults that are causing those symptoms are being addressed, and the mechanisms behind those symptoms and the mechanisms that have been interrupted because of these causes or because of these insults. So if all three aren't being addressed, you're not really being helped. If just the symptoms are being masked, you're not really being helped. I mean, you're feeling better for the short term, but in the long term, something is going to rear its ugly head. Something is going to come back to bite you, and it might even be worse. And it could even be something that becomes a catastrophic diagnosis. So let me give you some examples. GERD, reflux. So I was just asked to see an athlete by a parent, and I haven't seen them yet, but what I've been told is they're an athlete. They've been having digestive issues, nausea, vomiting, and they've become weak now because it's been going on for such a long period of time. They've been given a medication. I can't remember if it's Zantac or Prilosec, but it's one of these H2 blockers that you see these commercials where people are eating barbecue or drinking beer or whatever. Their stomach gets upset. You know, they pop a couple of these, whether it's Zantac or Prilosec, and now they're good to go, and they go back to the barbecue, they go back to the beer, they go back to the spicy foods. So yes, it is managing your symptoms. It's taking down your symptoms, but the underlying cause is still there. The mechanism, the thing that is making your stomach upset, that's making you feel nauseous, that's causing you to vomit, is still there, and it's not addressed. So let's say you take these medications for 6 months, for a year and a half, maybe it's 2 years. And because your symptoms are masked, and then eventually you see a holistic doctor that wants to get to the root cause, and now you find out, oh, well, you've had an infection this entire time. Or it could be that you haven't been able to produce the amount of stomach acid that you should be producing in order to digest your foods. It could be that the medication is giving you a side effect where now you haven't been able to absorb certain micronutrients over a long period of time, and it could be that now maybe you're anemic, or maybe there's an issue with another organ system because you haven't been able to absorb these nutrients. So this is just an example of something that could be very innocent. You know, the doctor that's helping you doesn't want you to be in pain, doesn't want you to be nauseous, doesn't want you to be vomiting, but by blunting or overriding the symptoms, your body's trying to tell you something. And it's the responsibility of you and the doctor to figure out the body's cry for help. What is the body asking you? Why is the body complaining? What is the body trying to tell you that needs to be helped, that needs to be resolved? I believe your body has an inherent wisdom, an inherent intelligence, and we need to work with your body. We need to work with your immune system, your nervous system, these innate healing abilities in order to help you be a better person, and in order to help you have the quality of life to be vital, to be vibrant, to be doing the things for you to be contributing the way that you want to live, the quality of life and the way that you want to live in this world. So I would like you to share this video with anyone that you know that's having any kind of medical issues or challenges, or someone who is frustrated with seeing their doctor, whether it's a specialist or a primary care, and they're just not getting the answers, they're just not getting the care or maybe even the respect that they are due. It's important to, as a physician, it's important to educate people so that you can make the best decisions for you and for your family. So again, please please share. This helps the algorithm. It helps this get out to more people. And then in the description, please make an appointment. I'm happy to see you. I'm happy to see you in person or via telemedicine, where we can discuss your concerns. We can come up with a strategy about your concerns, and we can also do rather inexpensive testing to give you a starting place so that you have a score, where you are, where your starting place is, and it can track and help you as you improve and as you try different therapies. All right, so thank you, and I will see you in the next video. Bye-bye.